Welcome to another beautiful episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Alhassan. Now, sickle cell disorder has been a familiar word to most people, and I guess at some point you may have heard about sickle cell or seen someone living with the condition. If you have or not, here is an opportunity to learn more on sickle cell emergence, effective way to manage it, and increase the quality of lifespan of those living with the condition. According to a report from the World Health Organization, 24% of the Nigerian population are carriers of the mutant gene, and the prevalence of sickle cell anemia is about 20 per 1,000 births. Well, to help us understand this better today is Dr. Maryam Mbaya, a general practitioner. You're welcome, ma'am.
Thank you.
How are you doing today?
I'm fine. How are you doing?
Great, thank you.
It's nice to see you.
Honestly, I would say thank you for creating time from your busy schedule to be here today.
It's my pleasure.
So today we're discussing sickle cell, but some persons understand it as maybe a disease, a condition, and probably we'll still be talking about maybe anemia. Some persons don't, we don't even understand what the difference could be. But first of all, I want you to tell us what sickle cell disease is in the most common language.
Oh, okay. So when we say sickle cell, I would rather use sickle cell disease or disorder.
Correct, okay.
Because this is the time you can interchange both of them, sickle cell disease or sickle cell disorder. Actually, there are quite subtypes of the sickle cell diseases. So the sickle cell anemia is a subtype of the sickle cell disease or disorder.
Okay.
So we have the sickle cell anemia, we have the sickle hemoglobin C, we have sickle beta plus thalassemia, we have sickle beta zero thalassemia. These are most common types of the sickle cell disorders.
It has types?
Yes.
Oh.
They are quite, and these four I just mentioned are just, let me say, the most common types. There are other types as well.
Okay.
So we also have the sickle hemoglobin 0, sickle hemoglobin C, and the rest. There are quite a lot of them.
So these types now, do their meanings vary according to the types?
Yes.
Oh, please share with us.
You know, when we say sickle cell disease, generally, we're talking about is a disorder that happens when somebody inherited a mutant gene, meaning the gene that is supposed to code for production of hemoglobin now is mutated, and that particular gene is what the individual has inherited, in most cases from both parents. Inherited this particular gene from your mom and your dad as well, because they are now healthy carriers. They are carrying that mutant gene. So when an individual inherits that gene, it results into sickle cell, meaning the hemoglobin is the one affected here. And what is hemoglobin? Hemoglobin is just a protein in the blood that is responsible for transporting oxygen. You know, our body, literally, whatever it is we do, we need that oxygen. All the organs, all the system of the body. That is what this in and out breathing. We breathe in oxygen, we take out carbon dioxide. So the oxygen that we take in is being transported by this hemoglobin in the blood. So when there is a problem, when the mutant form, now the abnormal form is being inherited, you know, definitely transportation of oxygen will be impaired.
True.
Yeah.
All right, so at this point, what can we pinpoint as some of the causes of this sickle cell disease?
Okay, the cause is basically one.
Oh, okay.
It is genetic, it is inherited. It is something that this is not the doing of whoever it is that is a sickle cell patient.
Okay, so the reason why I had to ask that question is we often hear that they would say this genotype and this genotype are not a match. If they come together, they're likely to have kids that have sickle cell. Now, why would what causes this genotype and this genotype to not be a match? Am I making sense to you?
Yes.
What is that factor that has made them, for instance, AS plus AS is no match? So what's that factor that has affected them that is making them carry the S along the A?
Like I said, it is inherited. Okay, the gene we have the normal, which is the A, and then the abnormal, which is the S. Now, if you inherit the S rather than the A from both parents, from this parent you inherited the S, and from the other parents you inherited the S as well. So you tend to be SS. But your parents are carriers. They are not sickle cell. They have the S gene, but they also have the normal gene, which is the A, which makes them healthy carriers. You understand?
Very
so
well.
when you now inherit the S gene from a parent, and then from the other parents you inherit the normal gene, now you're now AS. Do you understand? Combination of both make you to be AS. Okay, so it is advisable for you not to marry a partner with similar genotype. Why? Because the probability of you having a child with sickle cell is high. So that is just why we say they are not a match, just to prevent them from having a child with sickle cell in the future. And it's also possible that at the end of the day, they might not have a child with sickle cell. But the probability actually is high.
Because I was going to say, I doubt. Does that really happen that you have AS match and they probably don't have sickle cell kids?
Yeah, it can happen.
For probably 1 in 8,000.
Not really. Let me try and cite this example.
Okay.
I've heard several people are saying that, I don't know how they come up with that, but when you have, when AS and AS get married, and then the first child will be, is it AA? The second will be one kind of, I don't even know.
But you know, they
to,
used to say the genetic structure thing, you can calculate
I
it.
really want to clarify this. The thing
good.
now is, let's look at it this way. Back then in secondary school, we have in biology, they said Mendelian crossing, pattern of crossing. Right?
Yes.
So it's the same thing. So once you cross, let's say AS, you cross the first one, you get AA. You cross, you get AS. You cross again, you get AS. And then the last one is SS.
Yeah, so that's what
So we
believe.
have, these are the possible offspring you will have, right? Okay. So we have the first one we say is AA, while the two in the middle are AS, and then the last one is
SS.
Is SS, exactly. They don't have a particular pattern. Any one of them can come first.
Really?
Yes. So it's just like you have 4 balls, let's say this snooker ball. You have it, let's put it in a basket. You have 4. One is black, one is white, and the 2 are ash color or gray color. Let me use that. Then with your eyes closed, they ask you to pick anyone. That's how it is.
Wow.
So whichever one you pick, that is it. And that's the possibility in every pregnancy. It doesn't have to be, okay, this first pregnancy, you got AA, and then this next one, it definitely must be AS. No, it doesn't work that way.
Okay, but is there a way, just like you mentioned, even in pregnancy, is there a way to check while somebody is still pregnant, to check the kind of gene that this child is going to be born with while the pregnancy is still on?
Possibly, it's kind of impossible, because even while you give birth to the child, less than 6 months old is difficult to determine.
Wow.
So I want to talk of in pregnancy. Yes, because when the child is born, in most cases, they hardly come down with even the symptoms of sickle cell less than 6 months. Why? Because there's something that is called fetal hemoglobin. And that is a very different hemoglobin entirely. It doesn't have that chain. You know, in the hemoglobin, there is alpha, beta, and gamma chains. So in that fetal hemoglobin, and most of the time, the problem is happening on the beta chain of the hemoglobin. So in children, let's say in infants less than 6 months, they don't have, in their fetal hemoglobin, they don't have that beta gene. It's all alpha and gamma. So, and that is what will sustain them through that 6 months. Once it is 6 months and beyond, it started weighing off. So that is when the true hemoglobin will comes up. So, and if the child is sickle cell, it should be expected that symptoms should start manifesting at that age.
From 6
months and above. So it's kind of difficult for you to determine while the baby is still in the uterus.
So what are the symptoms that a parent could start to notice to be able to say, I think this child has sickle cell, even before they go to get tested to be sure?
In most cases, like in the infants, excessive pain, that's which, they cannot talk, so they will be crying, swelling, hand and foot.
Oh.
Yes, specifically. We call it dactylitis, that's hand and foot syndrome. It gets swollen and they keep crying excessively. And then another thing is failure to add weight. Despite adequate nutrition, despite adequate feeding, breastfeeding and all that, the baby is not adding weight. So these are the things that would, like, possibly there's something wrong. And especially when you know your genotype and you know the genotype of your husband too. It should be a signal sign.
So which simply means that, sometimes errors happen. And does that mean that there is no possibility of someone who's not even AS, or there's no possibility of maybe AA and AS combination having an SS child?
Well, you say in medicine we say never say never, but
I like that.
But it's rare. And when we say rare, this time around we're talking about 0.0001% in like 100.
You know why I had to ask that question?
Very rare. Yeah.
Because at some point you have people go for their genotype test, and probably today they've gone and it's AA. In the next few years, or they were AS, in the next few years, say it's now AA, and then there's a combination of maybe AA marrying AS. Maybe a once AS now saying, I am now AA, so I think I'm free now to get married to AS.
Yeah,
and then they now have a child that is sickle cell.
No, in such situations, miracle happens. Exactly. Healing happens. I've seen somebody that was once AS and later on he said he's AA.
Well,
Though
I heard doctors don't believe that.
No, we do, because I'm a Christian and I've seen a lot of things. I have seen a lot that medically we could not explain. So there's definitely God up there. So that is just it. Aside that, the thing is, like I said, miracle happens.
Sure.
Okay. And if miracle happens, if the person was AS and then now is AA, then he's AA. So, and then he went ahead to marry somebody that is AS, and then subsequently they're having a child with SS, then something is definitely wrong somewhere. Either there is an error, or the miracle did not happen, or there's error in the lab. You get it. There's definitely something wrong somewhere.
Okay, because you said it's a hereditary disease, is it possible to prevent it at all? Besides, getting married, besides, the first thing that society tells you is don't get married to each other so you don't have this. But if you have the situation of trying to get married to someone of the same genotype, which is AS, is it possible to prevent this hereditary disease from getting into the child?
Well, I would say if you plan not to have a child.
Really?
Yes.
That sounds like there's no preventive measure.
Because we don't determine, like I told you, the example I cited with snooker balls in the basket, with your eyes closed. How sure are you that you pick the one with AA, the one with AS, rather than the one with SS? You can never see. Sure. And anyone is a probability, and anyone can come. So the best way for you to be 100% sure is not to have a child. But if you will have a child, then you should expect any.
All right. So as a medical practitioner, I want to know, do you tend to push for the bill that before couples get married, they should always have a medical certificate of some sort to certify them to avoid these situations? Because it's not always easy. I've seen people that live with sickle cell condition, and they tend to go through a lot. But who's to be blamed? Most times their parents are already married. It's not their fault. So is it possible that you can push, as medical practitioners, push for the bill that a medical certificate should be as important as your wedding certificate?
No, these things, it's not against the law, and it's not something that should be imposed on anybody. We're not happy that the offspring are the ones suffering for what they know nothing about.
True.
You understand? So we can only advise. And to me, I would rather If you see anybody you like, after asking, hello, what's your name? The next thing should be, please, what's your genotype?
Wow.
Do you understand? Yes, it's that bad. Because every year in Africa alone, in fact, Nigeria, not just in Northeast, specifically Borno and Yobe, have the highest number of sickle cell in the whole world.
Wow. Why
Yes.
is that so?
Intermarriage, like from the same family. They intermarry without getting tested. You know, especially in Borno Yobe, they believe that your first wife should come from your family, either your cousin, like that.
Wow.
And it's also common in the southwestern part of Nigeria too. So, left for me, I would rather, after introducing yourselves, okay, before you go any further, that it will be difficult for you to make a decision. Because I've seen a couple that at some point, at the end of the day, they got married, they could not separate. They've gone far, started wedding preparations, and then after getting tested, both of them are ASAS.
Wow.
They post for some time, but they went ahead. And guess what? Their first baby came out to be sickle cell.
Oh my God.
And if you see, it's a very beautiful baby. But every now and then, they are in the hospital. So I feel it's not against the law. It's a choice. It's something that you want to do. It's not a crime. Nobody should be forced to do what they don't want to do, or rather do what.
True.
Yeah. So it's a matter of choice, and I just feel they should be enlightened. They should be educated, because you know, most people that have not experienced sickle cell patients, they don't know what those people go through. So they just assume it's nothing. It's just like they're just saying sickle cell, and so what? But if you've really come close to those people, you will wish if there's anything you can do within your power to take away that pain they are going through. So, and the best thing is to avoid having children with sickle cell.
Wow. This is, you know, this statement you made that people will never understand until they get to see them, you know, going through that pain. I think there's this family I used to know growing up, and then they had 6 kids, but 3 of them looked normal and 3 of them looked abnormal. Not abnormal per se, they were pale, skinny, and over the years, the family started losing them one after the other. The 3 that were skinny started losing them one after the other. And right now, I don't think any one of them survived, any of the 3 that looked pale, before we now heard that they're sickle cell carriers. And it felt so bad because they were already part of most of our lives and growing up together, and then discovering that they just go like that. Another thing I want to ask is, why is it that some of those that are sickle cell carriers actually look very okay, very well fed and well nourished, while some look malnourished, pale, and very sicky?
Yeah, like I said, the type of the sickle cell, the variants of the sickle cell, they also vary in severity. So depending on the type the person is having, also matters. And again, so many people are enlightened while a lot of people are not enlightened.
Wow.
Okay, for sickle cell patients, there are things we tell them to do.
Okay.
And if they adhere and do those things, it limits the crisis they go through.
Okay.
Yes. For example, what are the things that often trigger crisis? Crisis do happens. Whether nothing, like it happens because of that sickling shape of the red blood cell they have. Okay, so what are the things we do tell them to prevent it from happening often, frequently? Most of the time, you have to be sensitive in the sense that one, they don't get dehydrated. They don't get dehydrated.
Okay.
Yeah, they should take a lot of fluid, drink a lot of water. I understand taking water just like that is not easy, but they can make it in the form of either zobo drink, juice drink. Do you understand? Kunu, all those things, so that they'll be able to drink it
Often.
often. That's another thing, because dehydration often send them to hospital.
Okay, really? As
Yes.
simple as dehydration?
Yes.
Wow.
Why? Because, okay, the normal size or shape of the red blood cell is supposed to be biconcave. But in their case, it is sickle. You know the sickle that farmers use, sickle, that's how the
Yes.
shape is. It's really
Wow.
sickle. So moving in the circulation, it's kind of difficult for it to pass through. So it gets clogged together and then causes pain. But by the time you take a lot of fluid, you can imagine at least the congestion will be reduced. Exactly. So that's one. Another thing is extreme of temperatures. You know, when it is hot season, what do they do? Do you understand? You should try as much as possible to stay where it is a bit relatively cold for their body. You should avoid anything that will bring fever because the body temperature will rise.
Was fever avoidable?
It is. It is. Example are the things that causes fever, malaria, infection. And if you can prevent those ones from happening, definitely you reduce the rate at which you get fever. For example, malaria that is endemic in this part of
Exactly, because it seems like something
I
that
do tell my
cannot-
patients to get insect repellent cream. As they are going out like this, they can just rub it in the exposed part of their body.
Are you sure they won't
Mosquitoes.
react to such as well?
Yeah, there are those ones you react to and there are those ones you don't react to. There are different types actually. If you notice you react to this particular one, then you can change. Do you understand? And then you can also cover your body if you don't want to use anything. And then again, fleet your house, use mosquito nets. Then there's a drug we give them for the prevention of malaria too. If they are taking their drugs every day, it will definitely prevent the rate of getting infected by malaria.
Okay.
Infested rather. So that's another thing. And then, like I said, extreme of temperature. I've talked about the high temperature. Now the low temperature, cold season. Yes. As much as possible, let them cover their body very well, properly, because that too can trigger crisis. Aside that, there are drugs we give them that they should take daily to help with the production of blood. And if they do that, at least it will reduce the frequent visitation of hospital.
All right, this trigger now, does it vary per person? Like, for instance, this person A with a sickle cell disorder is usually triggered, their ailment is usually triggered by maybe cold temperature, and maybe sickle cell patient B is triggered by hot temperature. Do they have various triggers, or most sickle cell patients have about the same thing that triggers them?
Like you said, most of them have similar triggers. Do you understand?
Okay.
But this one can be coming down. Okay, what's the hallmark of the sickle cell? It's just pain and anemia. That's the hallmark of the sickle cell disease. So depending on whether it is what do you call it, sickle hemoglobin, sickle beta plus this, thalassemia, this, the hallmark is pain and anemia. Do you understand?
Very well.
Yes. So whatever it is that is triggering this pain now, do you understand? Be it extreme of temperatures, be it dehydration, be it infection, whatever it is that is causing, at the end of the day, most of them come down with similar symptoms.
All right. Let's go on a quick break.
All right.
All right, viewers, let's go on a quick break. When we return, Dr. Maryam will still be in the studio. Stay with us. Back, in case you're just joining us, this is Healthy Living, reaching you from the nation's capital, Abuja. And we've been discussing sickle cell disorder with Dr. Maryam Mbaya, who's a general practitioner. All All right, ma'am, before we went on the break, you were talking about how they can manage, how sickle cell patients can manage. But another question I want to ask is, are they allowed to live normal life, like go to the gym, do some exercises? Are they allowed to do that?
Yes, I forgot to mention that exercise helps a lot.
Okay, great.
Yeah, so I advise them to exercise as well as they are taking fluid alongside. Because once they exercise and then they are not taking fluid, they get dehydrated. And it will now be +1 -2.
Oh, true.
Do you understand? Because you exercise, you lose a lot of calories, you lose a lot of fluid, and then you're not replacing. Definitely they will come down with crisis. So in as much as they are exercising, they should be taking a lot of fluid, eat well, live a normal life.
People often look at those that have sickle cell disorder as people that are very weak and can't do a lot of things. So when I was talking about living normal life and exercises, I meant, can they also build body mass? Can they carry, lift weights? Can they do all of those strenuous exercising
we want
activities?
them to do exercise, but not strenuous exercise.
Oh.
Not strenuous exercise. Exercise that will make them keep fit. And you understand? And then eat well, drink a lot of fluid, and then they are good to go.
Okay, so because you said eat well, are there specific diets for them, to help them?
No. A diet is a healthy meal, right? So they're supposed to eat healthy. That's all.
Okay, because I had asked because I felt like if this is hereditary, maybe there's a diet that can boost the immune system and help it fight against.
We usually place them on those drugs that help boost production of their blood.
Okay.
So like folic acid, iron, all those hematinics, we place them on it so that it will help boost their immunity and then boost their blood production, as well as they are eating good meal as well.
Oh, okay. Good meal,
like balanced diet, just the normal day-to-day food.
Also, they can just consume the normal day-to-day food and they would still be fine.
Yes.
All right, so there are some myths on the street. I like to bring what people think on the street or what people just believe generally so that you can refute or reaffirm if it is true. People believe that those with sickle cell disorder usually don't last longer than 25. And if perchance they cross 40, then no more crisis, no more health challenge. How true is this?
Okay. First of all, I lost a mentor, and I is a medical doctor at the age of 64. I is a sickle cell.
Wow.
So, do I need to go further with that question? Because the thing is, there's no age. There's no age at which you say, okay, this person has crossed the death line, or this person has crossed
for the risk.
The sickle cell disease and will no longer come down with symptoms. There's no age. There's no age.
So those stories of when you're 25?
They are just stories.
But what about...
Because at 25, that doesn't mean your genotype will change. Except maybe the miracle, like I said. At 25, at 40, doesn't mean your genotype will still change. It's still you. It's still the same genotype.
So, is it possible to do some sort of surgery to take out all of these stem cells that can put you at risk and, more like you're having a new stream of blood and everything and your stem cells? Is it possible?
Yeah, they do stem cell transplant. But the stem cell transplant, okay, let me try and see if I can explain better.
Okay.
It helps for a very long period of time.
Okay.
But that doesn't mean your DNA has been changed.
Oh.
For example, if somebody is anemic, meaning he has low level of blood, and then you transfuse that person with blood, do you understand?
Very well.
Does that mean you have changed his DNA? No. That blood will be there, and a normal healthy blood, the lifespan of the RBC is 120 days.
Okay. What's RBC?
Red blood cell.
Okay.
So the lifespan is 120 days. So a red blood cell is supposed to live in your circulation for 120 days. That's for healthy. We're not talking about sickle. Sickle cell, theirs is within 40 to 60 days. That's the lifespan of their red blood cell.
Shorter.
It's shorter. So if let's say within 120 days, the red blood cell dies, and then new ones are being produced. The new ones are being produced from that gene, from that DNA. Do you understand? Because the genes are encoded, are coded within the DNA. So, and they are the ones that are responsible for whatever it is that is in our body. Production of red blood cell, white blood cell, platelets, whatever. They are the ones responsible because they are coded. Do you understand? It's just
very well.
Exactly. So they have not changed. Do you understand? So those stem cell transplant will definitely last you a long time. Do you understand? And you won't come down with crisis for a long time. But that doesn't mean your DNA has been changed, because the gene coding for that sickle hemoglobin is still there within the DNA. So it has not changed. So as far as it is still there, yes, those new stem cell that has been transplanted into the patient will definitely work, will definitely be there, because they are now healthy stem cells. So it will be there for a period of time. But as soon as they wane off, definitely the real genotype, the real gene will come to play.
Wow. But are there situations where the DNA can actually be changed? Hasn't medicine grown to that level?
Not yet. They are still working on it.
But that doesn't seem like it's going to happen anytime soon.
Well, no, nothing is impossible. So we are hoping for the best, actually.
All right. Aside this stem cell surgery, what other thing can be done to help a sickle cell patient, stay away from crisis for a very long time medically? I know you've talked about what they can do to take care of themselves so that they don't come down with, crisis. What about medically? What can be done to help them?
Yeah, like I said, we do give them drugs. There are drugs that will help with the production of the blood, will boost production of their blood. There are drugs that will help prevent malaria, especially in these endemic environments. And then again, there are drugs that will help. Yeah, basically that's what we do for them. And then once they take, for those ones that are regular with their medication, that they don't joke with their medication, believe me, they don't often come down with crisis.
Okay, and why is it that most times it's in our climes that this sickle cell is much more prevalent? I don't know, from your experience, the patients you've actually met, why is it that we tend to always have other cases where they lose their lives? Is it possible that if they get adequate treatment, they can live longer? How do we help them improve the quality of their life?
Exactly, like I said, the patient itself, the patient himself or herself need to be sensitive, need to pay attention to all those things I've mentioned. Do you understand? They need to take their drugs regularly. They need to hydrate themselves every now and then. It's not easy for somebody to just be drinking water. Do you understand? Even you, if they ask you to drink water, just be drinking. Do you understand?
Wait, is the water drinking now abnormal from the one that you take 8 sachets per day?
You and I now can decide not to take water and nothing will happen.
Sure.
Do you understand? Because we know at worst case scenario, we get dehydrated and nothing will happen. But it's not the same with sickle cell patients. So, and in that case, they need to take more water than any other person. So this has been a challenge, actually, because in most of the patients we see, okay, have you been drinking water? They'll tell you, they are tired, like how can they just be drinking water like that? So I was like, okay, can you make a zobo juice, kunu juice, any of these juice. Do you understand? So that you can actually take more of it without this thing getting tired. I'll be like, okay, they will do that. But it goes a long way if they have support from parents, family, and friends as well. Because most of these things, they can't do it alone.
True.
Do you understand? And it is exhausting, especially for the parents. You know, this is something that they've been doing right from childhood till they've grown, and they are still doing it. Do you understand? So they need that moral support from everybody around them. They also need to be sensitive. They also need to take their drugs. They also need to go on follow-up. Because that's one thing I noticed. Most of the time, so they don't even, you often see them in the hospital because they are always coming down with crisis. So they don't even want to come for the phone because they are already there in the hospital with you. So these are the things that if they are sensitive to, will actually help them and go a long way. They won't come down often with crisis.
Okay, and because you talked about them getting support, before I mentioned the support anyway, I wanted to find out, there's also a myth that for a woman that is a sickle cell carrier, I like to always bring these things so that doctors can clarify and clear the air.
Okay, let me say something. When you say sickle cell carrier, that means AS.
Okay.
When you say sickle cell patient, that means somebody with SS.
Oh, thank you for that correction. Okay, so sickle cell patient now, thank you. A sickle cell patient that is a female, as long as she's able to give birth to a baby, she's no longer at risk of sickle cell disease.
I can't even comprehend it. Who said that? Like,
well, that's what people believe. That so I've heard some people say. So okay, I heard someone say one day that a lady that had sickle cell. Okay, the woman was saying the parents should get her married. Once she gives birth, she's safe.
Is that simple?
Yeah.
Okay. Like I said, okay, we've had patients that are sickle cell and they are in their reproductive age. Some of them get pregnant. Do you understand? They give birth. Some through CS, most of them through CS actually. Yeah, but some still try and give birth in the normal way. Okay, so doesn't change the DNA. We'll still go back to the DNA. You've given birth, yes, but that doesn't mean your DNA has been changed. That was it.
True. All right, because you mentioned support earlier. What's the first thing that caregivers, parents, and everyone should do to support a sickle cell patient during their crisis, like a first aid to help them with before bringing them to the hospital? Okay,
they should have, first of all, when the crisis have set in, I think the best thing to do is to take the patient to the hospital. Okay. So the one way they can help is to prevent the crisis from happening. All those things I've mentioned. They can always remind them, give them moral support, emotional support. Yeah, I forgot to mention that. Emotional stress too will give them crisis.
Really?
Yes. Emotional stress. So coming back to the support, the best thing they can do is to prevent the crisis from happening. But once the crisis has set in, they should take them to the hospital. Because there are certain things that we do in the hospital that cannot be done at home. For example, blood transfusion. You cannot transfuse somebody at home.
True.
Exactly. And you need to do investigations too. You cannot do that at home. There are drugs we give under monitoring. You can't give them such drugs at home because we have to monitor the patient while we give drugs. So once the crisis have set in, you need to bring the patient in to the hospital. Like I said, emotional support is really, really, really important. Make them feel they are not alone, make them feel loved, support them in any way you can. Get them what they want, what they like, always be there for them. it helps them mentally.
So that means their mental health is also very important.
Yes, it is.
Okay, but people have always viewed sickle cell as a death sentence for so many years now. In fact, decades and decades. And before now, most of our parents thought that when they have children and the children die, probably for one reason or the other, they tag it to Abiku syndrome, stillbirth in English. Now, which means, and most of them could be sickle cell patients, and they probably didn't find out. So in all these years, why is it that nothing has been done to help sickle cell patients besides, asking couples not to get married to each other? What I mean is, are there no drugs to permanently take care of it?
Like I said, there is no drug that can permanently cure the sickling. Is in the gene, is in the DNA. So, the only thing is prevent it from happening, like we've earlier talked about, like knowing your spouse's genotype before even getting serious, before getting to that level that it will be difficult for you to make a decision. So it's always good to know it on time, and then know what to do, the next step to take. And then, so that is it.
So the types you gave us earlier, are the treatments according to the types?
Basically, like I said, the hallmark of the disease is pain and anemia. So most of them present with crisis, either vaso-occlusive crisis, aplastic crisis, splenic sequestration. Most of them have similar symptoms. So we manage it the same way, but just that they vary in severity. Yes, but most of them have the same symptoms, the same presentation, the same features, and the management is also the same, depending on what the patient is presenting with. If it is pain, we take care of the pain. Dehydration, we hydrate. Okay. If it is anemia, we transfuse. Depending on what...
So the symptoms are basically treated?
Yes, it's the symptoms. It's just a supportive management. There is no cure for it. But we just take care of whatever the patient is having at that moment. Be it anemia, pain, treat it, and then continue living your life.
Because you mentioned be it anemia, pain, can you just differentiate the anemia, the disease for us? Like you said, it's a sub. So when do we identify that this is anemia?
Okay, anemia. Okay, first of all, what are the things that you see in a sickle cell patient that will give you a hint? Probably this person is anemic. All right. Most of the time, they come down with jaundice.
Oh.
You see them, their eye...
Adults or babies?
You see more of that in adults.
Wow.
Yes, more of that in adults. And then in children, yes, like especially less than 5 years old, those ones having splenic sequestration, they come down with, you can see the jaundice, and then they come down with abdominal swelling. Yeah, that will also be a pointer.
Abdominal swelling, that sounds like kwashiorkor that we all call.
No, not all abdominal swelling is kwashiorkor. Like in that, there is a type of complication of the sickle cell. Do you understand that? Okay. It's called splenic sequestration.
Okay.
Yes, and the spleen, right?
Yes.
Yeah, it's an organ in the body and the abdomen. So that splenic sequestration is massive enlargement of that spleen, and it's common in sickle cell.
Okay.
That swelling is due to, because the spleen is mopping the blood from the system. So definitely they will be anemic.
All right.
Yeah.
So thank you so much. But in rounding up now, what would you advise viewers at home, those that are sickle cell patients, their parents, supporters, viewers in general? What are the do's and don'ts? What would you advise? Okay,
first of all, let's start with the couples intending to get married or intending to have a baby. First thing first. If you have not started a relationship, ask for genotype.
Very important.
that it cannot be overemphasized. Ask, know the genotype, so it's easier for you to make a decision. Yeah, it's not a crime if you decide to go ahead with it, but also bear in mind that somebody else will be suffering the consequences of what they know nothing about.
True.
And is due to your own making. Okay. Then for those that are already in it, do you understand? They have babies that are sickle cell patients. The thing is, don't get tired. We know it's not easy. We always see we have them in the hospital. It's psychologically draining to parents. It is. We understand, especially for those ones that knew nothing about sickle cell. They just got married and then their baby is sick, coming to the hospital. They are now telling them that it's something called sickle cell. Do you understand?
Very
and
well.
Some parents go to the extent of hating each other. They can seek therapy. They should not get tired. They should support the child, be with the child. And all those things I've mentioned, if they can be able to support that child, definitely the child will live long, and even, who knows?
True. Never say never.
Never say never. So that's another. And then for those ones that are having the sickle cell, like I mentioned, please, 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 I don't want to sound selfish by saying, when you take care of yourself, you reduce work for us, but that's the truth. Do you understand?
Health is wealth.
Exactly. You reduce work for us in the sense that we don't see you in the hospital often. And we are happy because we're not seeing you often. We know that that means you're living your life instead of being in the hospital all the time. You understand?
Very well.
Take care of yourself. Avoid things that will give them infection. Avoid things that will give them malaria. We've always placed them on drugs, especially Probanil. Yes, we do place them on drugs to take so that it will prevent getting infested by malaria. Hydrate yourself. Avoid anything that will suffocate you. Lack of oxygen. Do you understand? Yes. Don't be in a stuffy environment. Yeah. Take a lot of water. Take a lot of fluid. Eat good food. Exercise. Live your life and enjoy. And for parents, please be there for them, because it's not easy. They see their friends enjoy their life. They do certain things that they cannot do.
They can't do.
Yes. They need that mental support. They need that emotional support. And please, for their spouses, try as much as possible not to give them emotional stress.
True, and stigmatization too.
Exactly. So sickle cell is not a death sentence. It is not. Like I said, I lost a mentor that was 64 years old, a medical doctor, a consultant.
Wow.
To sickle cell. So if he can go that far in life, he can do it. Any other sickle cell patient can do it.
True.
Yes.
Thank you so much, Dr. Maryam Mbaya. Thanks for your time. We really appreciate you today. All right, viewers, that's where we draw the curtain on the show. Do not forget that sickle cell is not a death sentence. You can always manage it, and you can live your life even longer than you would expect. And that's how we draw the curtains for today. I am Olamide Alhassan. See you again.